Instead of focusing on winning arguments, we're teaching the basic fundamentals of sales and marketing and how we can use them to win in the world of politics, teaching you how to meet people where they're at on the issues they care about. Welcome to The Brian Nichols Show. Well, hey there, folks. Brian Nichols here on The Brian Nichols Show. And thank you for joining us on today's fun-filled episode. Today, we are joined by a doctor who started off in Canada as a socialist, and now he is leading the charge trying to help install some type of normalcy here in our healthcare system. Dr. Lee Kurisko, welcome to the Brian Nichols Show.
Well, thanks, Brian. Glad to be here.
Well, it's absolutely great to have you here, and thank you so much for taking the time to join us today. So what we wanted to do, Dr. Kurisko, is number one, start off by introducing you to the Brian Nichols Show audience. What got you on this path from originally starting off socialist upbringings and ideas to now where you're embracing a free market approach to the healthcare solution system?
Yeah, well, I was, lived most of my life in Canada, and it's just part of the cultural ethos there that it's the right thing for the government to take care of people and provide them with their health care. And I remember going to the local clinic as a child, and there'd be no money exchanging hands. And that's just the way it was. And I used to think it was kind of absurd that people in the United States had to be responsible for their bills for health care. And I labored under that delusion for many, many years. Ended up going to medical school, worked as a family doctor for a few years, and then decided I wanted to go into the field of radiology, so studied to become a radiologist. And then shortly after completing my training as a radiologist, I found myself medical director for diagnostic imaging in Thunder Bay, Canada. And I was confronted with the problems that we had to deal with, which were incredible shortage of resources. We simply did not have enough doctors. For a while, we had 3 radiologists serving a population of 250,000 people. When the American College of Radiology at that time recommended 1 radiologist per 13,000 people. And the reason there were shortages is because they were engineered by the government. With a healthcare system that's quote unquote free, there has to be some way to put the brakes on healthcare expenditures. So it was official government policy to reduce the number of doctors that were trained. Because doctors are sort of the rate limiting step in the delivery of care. They're the ones that, admit people to hospital and order medications and tests and so on. So that was official government policy. And so they quite vastly overshot the mark to the point where in Canada, we were about 30% fewer doctors per capita than in the United States. And then due to some various personnel issues and so on, we had a meltdown of personnel. We only had 3 doctors serving this large population. We'd started out with 8, which was actually still underserviced. The Ministry of Health said we should have 13. We had 8. We ended up with 3. And so I was working day and night trying to deliver good health care. And around this, and the shortage, the kind of things that we were facing was that, our wait time for a CT scan was 7 months long. Our wait time for an MRI was 13 months long. We had equipment that was outdated and even somewhat dilapidated. There weren't enough specialty services. I personally knew some doctors, their wait time was 2 years long. It just goes on and on. And across the country, Canada, I just checked this afternoon, the Fraser Institute in Canada monitors wait times. And right now, the average wait time from referral from a family doctor for specialist care is 21.6 weeks. And of course, you have to have a family doctor in Canada to get a specialist referral. And 17% of the Canadian population, as of the time that I was there, up until 20 years ago, did not have access to primary care. No primary care, no specialist care. And in fact, in Thunder Bay, 40% of the population did not have access to primary care. So, we were in a desperate situation. And just by serendipity, I happened to read a book at the time that I was dealing with all this called Atlas Shrugged by Ayn Rand. And for those of your listeners that are not familiar with the storyline, the basic storyline is it's a fiction about what would happen as the United States moved into socialism. And over the course of a very long book, as time goes on, civilization actually collapses. And the main characters of the book are these industrial capitalists that are trying to do their job and bring their goods and services to market. But every which way they turn, the government is in the way, obstructing their ability to do so. And I was in this situation up in Canada. We had these shortages. I had innovative ideas about how we could improve the service. I'd gone so far as contacting the premier of the province to say, could they please allow special dispensation to let some doctors in from South Africa? And South African doctors are really quite well trained. And they're part of the British Commonwealth, so you would think that, you know, they would be accepted at par, but they wouldn't do so, despite the fact that we were just dying trying to deliver care. I had ideas about how to make the department more efficient, and if anything cost any money at all, there was no interest because the system was run by a budget more so than by profit. And so I read this Atlas Shrugged, and I saw the analogy in my own life about how, you know, the government was not a benevolent force. They tried to portray themselves as a benevolent force, but they really weren't. They were really an obstruction to the services that would exist if you simply allowed them to exist by getting out of the way. And so I came to this realization that, you know, government is not the solution. They're actually the problem. And I read some other books. There's another book called Bionomics by Michael Rothschild, it details like how businesses and capitalist systems are much akin to ecosystems in that they're continuously reorganizing and sorting out the wheat from the chaff, and the more successful enterprises sort of rise to the top. And that with government, there's really no way that any central body can do such a thing because government is sort of ossified and rigid and bureaucratic. And it made perfect sense to me that this is why we're struggling in healthcare. It's because the government's involved. And so it was a major wake up for me. And it was more than just sort of the pragmatic aspect of delivering healthcare, but I realized that government needs to get out of people's lives because it's a moral issue, because people are entitled to their own liberty and their own lives and the right to live them freely. And when government becomes a bigger and bigger part of our lives, you know, liberty melts away. And it's fundamentally government involvement in anything is based on coercion. And coercion is immoral because implicitly it's a threat of physical force if you don't comply. So that was my wake up. That was my great awakening from my socialist trance that I had been in for 40 years. And so I just started to view the world in a very different way. And I realized I had to move to the relatively more capitalist United States if I ever wanted to be happy in my practice of medicine. So that's how I ended up in the United States almost 20 years ago.
Wow. And you read Atlas Shrugged and you said you thought it was fiction. Well, Dr. Kurisko, I don't know if that's necessarily true when you're looking at 2020, what's happening, and then going forward to 2021. A lot has happened. But
I agree.
Oh, I say, but hey, there is hope because there are people out there like you, who are fighting the good fight, and especially in response to what we just saw happen here with COVID-19. We saw the healthcare system really have to come to grips with a lot of the regulations that have been put in place, and a lot of these regulations that were put in the name of doing good. And you already experienced it firsthand. It's funny. I just had this conversation with my sales team. So in my day job, I lead a sales team in the greater telecommunications cybersecurity world. And when we were talking, one of my reps, he's really excited. He's going to be getting a promotion soon. And he was talking about the next steps and trying to figure out, the future, but like things he can avoid in the future. And I walked him through, hey, find mentors, find people that you can learn from, because not just all the great things they've done, but the things that they have failed at. And then they can help you avoid those pitfalls in your career, in your life. The same thing is true, I think, when we're looking at people like you. We see this, there are people like Michael Malice, coming from the former Soviet Union, people who grew up in areas that have experienced what it is that true socialism, true leftism, true progressivism looks like. And to actually stand up and say, no, I mean, good friend of the show here, Martha Bueno, she's running for Miami-Dade commissioner down in Miami, Florida. She is her family's from Cuba. Her mom broke her dad out of Cuban jail, and she is a rabid pro-capitalist. And you see sometimes the most pro-capitalist, pro-free market people are people who have experienced the worst, the alternative, and that is the progressive leftist approach. So where, and this is where I preface this, where do we then lose the argument? Where do we lose the folks there in the middle who are looking for solutions, because I dare say the free market approach makes the most sense, but is it that we're competing against this notion of a free healthcare system and people get captivated, that is, by the term free?
Oh, absolutely. In Canada, there's this myth about American healthcare that it's this evil capitalist system that will let people die in the streets. And yet I've been here for 20 years. I've yet to see that happen. I've seen far more failure to deliver care in Canada than I ever have in the U.S. I mean, one way or the other, they seem to make it work and people get their care. The other thing is that, the cost of healthcare is kind of buried in taxes and whatnot, so people think it's free. But the Canadian healthcare system is still one of the most expensive systems in the world. If you look at the other, advanced countries. So it's not free by any means, and there's always hidden costs. Like for example, I used to do this procedure up in Canada called angioplasty, where you feed a catheter up into a blood vessel and you stretch it out. And then, often it would obviate the need for open surgery. The recovery time was shorter. People could get back to work quicker. But then it got out that I was going to move to the United States, and the vascular surgeons were freaking out. Well, who's going to do the angioplasties? Well, the reimbursement was very, very low. I think it was like $90. It would take about an hour. Half that's going to taxes. For $45, I was doing a procedure, assuming potentially millions of dollars of liability. And there were a few other people in town that could do the procedure, but they just simply wouldn't do it because, it just wasn't worth it. But even now, people would think, oh, they're getting that angioplasty for free. Well, not really, because if you're delayed getting it, you wait months on end. You may be missing work. You're incurring, disability. And so the true costs actually don't go away. The true total costs don't go away just because government has arbitrarily pegged a price for what they think they should reimburse. So, what happens in market systems is that there's an alignment between what people are willing to pay and what the price will be that is asked for. And then there's a meeting point, and then people realize that there's a balancing of what is being provided in worth for, what is being paid. And it's a non-coercive system. Now, what happens in the United States? I mean, there's certainly a lot of issues in Canada, and there's a lot of issues in the United States. But what happens in the United States, where most people are insured? Now, it sounds a bit crazy, but Obamacare insured more people, thereby increasing the number of people who have unfettered demand for healthcare. The demand for healthcare has gone up, and so the amount of healthcare to be provided, it's gone up. But when there's a third-party payer, whether it be the government or the big insurance plan, is there's no balancing of what is being obtained for what is being spent. I see it day in, day out, like minor head trauma. People are getting CAT scans, and yet it's been scientifically validated that they don't need them. And yet, because somebody else is paying for it, we're going to just order this test and it'll be done. But then we run into the problems where too much is charged for the CAT scan because the patient's not paying, the insurance company's is paying for it. There's too many CAT scans done. And so we have this runaway growth in healthcare expenses in the United States that will not be reined in until we have a completely different model where the purchaser of healthcare is the patient who makes the decisions about whether or not what they're getting is worthwhile for what they're paying. And it's a naive view to say that, more healthcare is always better. There should be a balancing of the healthcare that's consumed based on what you're going to get from it. I mean, I'd like to give the example of my dog. She's old now, but she's always had some issues with her elbows. And I remember bringing her to the vet, and we discussed, well, should we get X-rays? Is it going to change anything? Maybe we could just sort of modulate her exercise a little bit. Don't let her run around too much. And if things get worse, then we can look at doing an X-ray. And, because I'm the consumer, I'm the one that's going to spend. And we have the conversation, well, it's not really worthwhile to get the X-rays this time. We'll just cut back on her vigorous activity and see how it goes. But there's never had that conversation in human healthcare. It's just the test exists. We'll just match the test up with the symptom, and we're going to just order it. And so you have these costs that just run wild. A number of years ago, she tore a ligament in her knee. and she was quite disabled by it. So we brought her to the vet, and I had veterinary pet insurance on her, which is actually, I think it's the best structured pet insurance plan that it's the best structured health plan that I've ever seen. It only kicks in for catastrophic losses. The purpose of the insurance is to kick in for catastrophic losses. The plan does not pay for routine things like immunizations and whatnot that I know are going to happen. And therefore, those things are reasonably priced because the veterinarian is answerable to me for what they're charging. And so she had this injury. Let's see, the costs were $2,850 to get the thing fixed. I had a $1,000 deductible, and the insurance plan said that they would cover $1,800. They gave me the check, and I could spend it anywhere I wanted to get her knee fixed. So the veterinary service that I was dealing with charged $2,850. I had to kick in an extra $50. I paid the deductible, so for the most part, it covered it. And so even when I made a catastrophic claim, I still function as a consumer. And so we could move towards a healthcare system where the patient is always the consumer, even within the context of government programs like Medicare and Medicaid. Rather than having a defined reimbursement schedule for different services, you put money to accounts, and then those patients own that money, and then they can shop for services. And then if they manage the money well, and as time goes on, it can grow, and there can be more and more money is available as time goes on to purchase services. And if they have money left over when they die, they could pass that on to their heirs. There's all kinds of creative pro-market methods by which we could get healthcare prices down. And as far as people that are truly, indigent, there are other ideas. Like, for example, charity healthcare. A mutual friend, Dr. Barry Sabrin, talks about this a lot, where there's clinics that function by private donations. There's a clinic at Zarapath Health Center in New Jersey, run by Doctors Alita and John Eck, where they function by private donations. And I spoke to Alita a number of years ago. The price for a given visit, this is probably data 10 years old, but if a patient was to be seen at the local emergency department, the charge was in the order of like $1,300. If they were to be seen at the federally qualified health clinic, the charge was around $600. But if they were seen at their volunteer clinic, the price that was covered by private donations was $13.
Whoa.
Yeah, it was just mind-boggling how efficient the system was. And they had creative ideas where they would get drug companies to donate samplers, and people would volunteer their time. And like I think they actually had like a waiting list for people that wanted to volunteer. I mean, by and large, people I think are good and they want to help. But the point is that even for the indigent, there are plans, strategies that you could invoke using a marketplace and voluntary charity by which everybody could get the care that they need, and it would be far cheaper than it is right now, and probably better quality and more rational, because more healthcare is not necessarily better.
People are starting to realize that right now, that even despite all the wonderful things that we had in our quote unquote good healthcare systems, was it actually good healthcare? Was it giving us good results, or was it just treating the ailments we have? And I think one thing that you brought up, it was actually more at the beginning there, was this. We see this in sales. You talk about all the features and benefits, and you kind of will get people bored. But when you start talking about what are they actually missing out on, and you start talking about the return on investment, but also the things that you're missing out on if you don't make that change. And this is something that we see a lot of salespeople. It kind of separates the good from the great. Is, can you focus on that area where you have a situation where you can help paint the picture of, okay, you don't make the decision, right? You don't get to move forward. What happens then? And in your example, talking about, well, if that's the case, you're stuck. All of a sudden, now you have a situation where you aren't getting your health care, despite it being free, right? Despite it being in abundance. And despite that, you still don't have access. You have to wait 3 months for a life-saving procedure or screening, but you can't even get in front of somebody. 3 months, heck, it might even be 3 years. Who knows? So I mean, what can we do? And I would ask from your inside perspective as a doctor to help get the conversation maybe switching a little bit more towards this free market approach? Because I see right now, unfortunately, a lot of people are embracing these ideas that have been promoted from the left, saying, well, we need more government control of healthcare.
Mhm.
How can we win that argument back? And maybe does it have to even be an argument? Can it just be putting great solutions out there like you're already doing right now?
Yeah, yeah. I mean, I think we need to have a conversation about solutions. It's not enough to just be against the failures of the Canadian healthcare system and the current failures of the American healthcare system. You have to be able to offer up creative solutions, and we touched on that a little bit. I mean, other things you could do would be when doctors provide care to the indigent, they get either a tax deduction or tax credit. We talked a little bit about the direct transaction, so people are sort of figuring out if something is worthwhile to spend money on. But that, along with charity care and like true insurance that's in place to cover large unexpected financial losses rather than every hangnail and sniffle. I mean, I think those are the three strategies by which you could build a rational healthcare system. Unfortunately, the failures of government lead to more intervention, which leads to more failures of government. And so the government just gets bigger and bigger, just making the situation worse and worse. I mean, healthcare would not be as expensive as it is right now in the United States if the government had not gotten involved in the first place. And it all started back during World War II, when there were wage and price controls, which I'm sure your listeners understand caused more harm than good. But employers wanted to be able to compete in some manner for employees, so they were able to offer health insurance, which was tax deductible to the employer. And so this system was set up whereby we have insurance that's linked to our employment, which doesn't make any sense. I mean, my homeowner's insurance isn't linked to my employment. My car insurance isn't linked to my employment. Why should I have health insurance linked to my employment? And really, to a large degree, everybody thinks that insuring everybody is the solution, but at its root, insurance, which is really prepaid medical care, is actually the problem. That's the problem that we need to get away from. And it's absurd how much people are spending for health insurance under the current model. If you could say, look, rather than spending $16,000, which is taken off your wages every year, we can structure it so you've got money in your pocket that you can spend on other things, your kids' education, remodeling your kitchen, a new TV or whatever. I mean, I think, maybe point out to people that they have something to gain here by actually getting out of the current system.
Well, we have about 3 minutes left, and I know we're already hard pressed for time, which is just sad, tragic, because we this conversation is, I think we're at the tip of the iceberg. So we'll have to do is we'll have to get you on for we'll have to get you on for part 2 because this is fun. And it's great too because it makes it more real. Because it's one thing for me to say, as the privileged American that I am, that I've experienced what the American healthcare system looks like. And I don't know. I have no context of the socialized medicine that everybody wants here. You do, and you've lived it, and you've experienced it firsthand. And that firsthand anecdotal experience, though it is anecdotal, it does bring real context to, I think, what is really it's rose-colored glasses in terms of how it's presented. And we need to get better in terms of articulating not just the negatives of what that would bring to the table, but also, the positives of what the free market and, solutions that exist out there already, but also the ideas that are being discussed. And Dr. Kurisko, you just had a brand new book, Health Reform, The End of the American Revolution plugs. Where can folks go ahead and find that barn burner?
Well, actually, it's been out for a number of years. I actually wrote it before Obamacare was even a thing. And it was predicting the current problems that we're facing right now. But it's available on Amazon.com. If you just put my name in, Lee, L-E-E, Kurisko, K-U-R-I-S-K-O, in your Amazon search, it comes right up. Or you can also order it from Alethos Press, A-L-E-T-H-O-S, press.com. And it's in there in the catalog of books that they sell. So hopefully people will check that out.
Fantastic. And what we'll do, folks, is because obviously we want to make it as easy as possible for folks to be able to continue the conversation. We will include the link to the book as well as your biography here in the show notes. And also, folks, you go ahead, click the artwork to the Brian Nichols Show in your podcast catcher. It'll bring you to today's episode, along with the entire transcription of the conversation, including all 370 plus other episodes of the program. But with that being said, Dr. Lee Kurisko, thanks for joining the program.
Thanks for having me.
Thanks for listening to The Brian Nichols Show. Find more episodes at briannicholsshow.com.